Ladies and gentlemen, dear colleagues, that's the title of the topic. Insulin resistance. Is it an actual pathologic compromise of cellular integrity, or it is just a potential toxic influence on cellular function? Aim of study: demonstration of an attractive, striking finding that insulin resistance is not an actual pathologic compromise of cellular integrity, but it's a potential toxic influence on cellular function. That's to say, it is not a permanent pathology of the cell, but it's a temporary toxicity affecting function of the cell that could be simply cured and corrected. Motive and idea. That's attractive and logic. The motive. Why insulin resistance nowadays is flaring up so frequent? It is the pollution. The worst is medicine. The chemical pollution by medicine. The aggressive antibiotics. The idea is also interesting. Assume a person is having a boil in the neck, so he cannot function, work, enjoy food or sleep, exercise, or even watch the TV. Without intention, he touches his neck, ruptured and drained the toxins from the boil. All of a sudden, he is back to himself again. In the same way, accumulation of toxins in the colon could lead to toxic pancreatitis and stress diabetes among the susceptible population. If toxins are cleared, the diabetic condition could be corrected. That's a fact which has been already peer-reviewed, accepted, and published in literature. To the extent that the world's burden of diabetes during late decades is not on the account of type 2 diabetes, but on stress diabetes because of toxic pancreatitis. Type 2 diabetes is not curable, but stress diabetes could be corrected. That's also a fact which has been already peer-reviewed, accepted, and published in literature, and presented in this elegant conference in Brussels last year. In a similar way, accumulation of toxins in the colon could influence cellular function so that cells could not uptake insulin to consume glucose in order to gain energy for its biologic functions. Colon clear eliminates toxin, restores cellular function, and makes insulin resistance a big scientific lie. Insulin resistance then could be just a plea of a fake scientific fantasy. Or else, where was insulin resistance hiding before the aggressive anti-H. pylori antibiotics? That's simply so. In brief, and it's all logic, looks scientific and evidence-based. That's what the research centers do not tell, and that's why modern medicine does not know. What's next until conclusion is not a big deal. So don't bother to concentrate very much until the conclusion, until the results and conclusion. Design and setting. A prospective multiple case clinical study done during the period from October 2019 to May 2023 in Zaytuna Medical Center, Medina, Saudi Arabia. Patients and methods. 27 patients with type 2 diabetes on oral pills, then shifted to insulin, later developed resistance to insulin. That's patient insulin therapy. Patient's blood sugar level was ranging between 180 to 210 milligrams per DL while on insulin. All were investigated for the existence of colonic Helicobacter pylori strains. A potent natural colon clear measure was done for all of them. Results. The results. All patients were found positive for colonic H. pylori strains, which is the source of colonic toxins. Most patients showed marked recovery of response to insulin after colon clear. Even they needed to reduce their usual insulin dose to near the half or less for fear of hypoglycemia. Their blood sugar level became ranging between 110 to 130 milligrams per dl. The concept of these results is being further supported by the observational findings that some physicians do modify or attenuate clinical symptoms of insulin resistance by intermittent fasting and ketogenic diet because of reducing the amount of toxins introduced into the gut. That's failure of therapy. 3 patients remained resistant to insulin in spite of revision of colon clear, possibly due to improper care about their diet and outside home meals. That's patients follow-up. 18 months and carefulness about their diet and colon care and colon clear. Conclusion. The conclusion. The challenge of insulin resistance might be just a temporary potential toxic influence on cellular function, rather than it's a definite permanent pathologic compromise of cellular integrity. Accordingly, insulin resistance might not be a definite disease entity that requires a specific treatment, but it could be just a potential condition consequent to a biological toxic stress inducing temporary cellular dysfunction that could be readily corrected by simple detox measures. That's to say, insulin resistance is a temporary dysfunction of the cell, but not a permanent compromise of cell integrity. Therefore, accurate revision and severe scientific redetermination of the evidence-based scientific guidelines of H. pylori eradication are seriously needed. Thank you very much. And as presented in ICMS 40, Revestia International European Medical Conference held in the University of Brussels, Belgium, September 2024.